SIBO or small intestinal bacterial overgrowth. I think I have SIBO. Probably not. Google said I have SIBO based on my symptoms of bloating and diarrhea. Possible, but probably not. So lots of people think they have SIBO, and that's a common diagnosis that comes into our practice as self-diagnosed or based on their internet search. Again, SIBO, small intestinal bacterial overgrowth, is a specific term that has a lot of controversial aspects to it in terms of diagnosis, treatment, and the causes. Let's run down quickly to try and explain what that means and what we know so far based on the data we have. So generally, the small intestine is not an area where there is a lot of bacteria. There are some, mostly gram-positive bacteria, up to 10 to the power of 3 per ml. And when that count increases to more than 10 to the power of 5 bacterial colonies per ml, then it kind of goes into the diagnostic criteria for SIBO. And it's not just gram-positive, but at that point there may be other organisms, Klebsiella and so on. Even the causes, why does this happen? More bacteria in certain individuals than others. There are certain conditions that predispose to SIBO, which is any intestinal surgeries, gastroparesis, diabetes, very rarely sometimes IBS, metabolic disorders like scleroderma, polymyalgia, autoimmune conditions. So when there is a history of surgery, there could be loops of bowel where the fluid or the intestinal contents does not move as actively as it's supposed to. So there's stasis or things slow down, and then it helps the bacteria develop. Symptoms that might be associated are diarrhea, usually diarrhea, sometimes bloating, malabsorption, and vitamin deficiencies or nutritional deficiencies because of malabsorption, and osteoporosis, bone thinning, again from malabsorption. How do you diagnose it? There is intestinal culture, or you have to go in with a longer scope into the small intestine, aspirate, and then send it for culture, and that is tedious. It's not easy to do. Or there's breath tests, which detect the rise in hydrogen from baseline. If it's more than 20 or more than 20 from baseline, it qualifies for SIBO. Again, it's not a common thing, as common as we think it is. There is certainly an overlap of all the symptoms from SIBO with other conditions like IBS itself, or more commonly even constipation causes bloating, and that seems to be more common than actually bloating from SIBO. If there is SIBO, what are the treatment options? Treatment options usually, if there is diagnosed SIBO, is first of all trying to detect what the underlying condition was and treating it. If there's a narrowed area, correction of that in the small bowel. If there is slow movements, trying to correct that. But antibiotics play a role, like rifaximin or other amoxicillin and other combinations, and maybe possibly probiotics. Again, these are all not 100%, but to some degree they might help. But if you're suspecting SIBO, the number one thing is to, again, talk to your doctor, because a lot of things look like it, but very few things actually qualify for SIBO. So hopefully that helps. But again, we can do a breath test and see if there is a real diagnosis and then address it.